Epilepsy is one of the most common conditions affecting the brain. It's a disorder that causes seizures, and it often affects people in very different ways. In this week's Focus on Your Health, Teresa Snow shows us a Benton County woman who spent years trying to control her symptoms until doctors restored her peace of mind.
Focus on Your Health is sponsored by MU Healthcare.
Medication is most commonly used to control seizures and help prevent injury or even death. But for a Missouri woman, it was a life-changing surgery that brought a new sense of freedom. For the past decade, Kim Neese has been knitting. It's a calming hobby, and her favorite color of yarn has added significance. Purple is the color of epilepsy awareness, a disorder that affects nearly 3.5 million Americans.
I was 15, went to sleep one night, and my brother found me having 3 grand mal seizures.
In Missouri, more than 61,000 people like Kim live with active epilepsy.
To put it simply, there is an electrical storm generated by the brain cells or the neurons that creates the symptoms of seizure.
Susanta Bandyopadhyay is a neurologist who specializes in epilepsy at University of Missouri Healthcare. He prescribed 2 medications, but Kim's epilepsy was drug resistant and the seizures continued almost daily.
About 2/3 of patients with epilepsy will have their seizures under good control with medication alone. But 1/3 of patients are not that lucky.
After extensive testing to pinpoint the area of the brain where Kim's seizures originated, Dr. Bandyopadhyay recommended surgery. An MU Healthcare neurosurgeon removed the seizure-causing tissue in her brain.
The bottom line is that the surgery works in conjunction with medication.
Bring him back.
Kim still takes medication, but now it's working. In the 2 years since surgery, she's only had a few seizures. She's able to focus better, both on schoolwork and her favorite romance novels.
Peace of mind that I don't have to worry if I'm going to have a seizure this day or not.
Turning a new page on life. Often the cause of epilepsy is unknown, but it can be caused by head injury or a central nervous system infection. To lower your risk, the CDC recommends using bike helmets and seat belts to help prevent traumatic brain injuries, and getting vaccinated and preparing food safely to avoid infection. With Focus on Your Health, I'm Teresa Snow.